There's something most men notice at some point, and almost no one talks about. You look down, and something feels different. Smaller. Less than it used to be. You tell yourself it's the angle, the lighting, a bad day, but the thought doesn't go away. Here's what I need you to hear right now. You are not imagining it. Penile shrinkage is real. It's measurable. It's medically documented. And it is happening to millions of men who have no idea why or that it can actually be reversed. I'm Dr. Narita, a board-certified urologist with over 12 years of experience. And in this video, I'm going to tell you the 5 hidden reasons this happens, including one that your own doctor probably hasn't mentioned, and then the 5 proven strategies to fight back. Stay with me, because what you're about to learn could genuinely change things. Before we start, hit that like button and subscribe. Every week I cover the men's health topics nobody else will touch. Now let's go. Cause number 1, poor blood flow. And it's silently doing damage right now. Most men don't know this. Your penile tissue needs regular blood flow even when you're not aroused. Not occasionally. Constantly. Because without it, the tissue changes. The 2 chambers inside your penis, the corpora cavernosa, are made of smooth muscle. When blood flow drops due to high blood pressure, high cholesterol, cardiovascular disease, or even just years of sitting too much, that smooth muscle starts to be replaced by fibrous tissue. Stiffer, less elastic, less responsive. The result? Measurably smaller resting size. Erections that don't reach their full potential. Here's the part that matters. This is not aging. This is a circulation problem. And circulation problems can be addressed. Think of it this way. Your cardiovascular system is the irrigation system for your entire body. If the pipes are clogged, the garden suffers. Your penile health is a direct reflection of your heart health. Keep that in mind. It becomes important later. Cause number 2, the fat burial effect. And this one surprises almost every man I tell it to. Your penis doesn't shrink from weight gain. But it absolutely looks smaller, and functionally, it is smaller. Here's why. The base of your penis sits beneath a fat pad called the pubic fat pad. As that pad grows with excess body weight, it literally buries the base. Covers it. Hides it. The research shows that for every 35 pounds of excess weight, roughly 1 inch of visible length disappears into that fat pad. 1 inch. Gone. Just buried. And that's not all. Excess body fat raises estrogen and lowers testosterone, making the entire system work against you hormonally at the same time. But here's the part 1 I want you to really sit with. This is the most reversible cause on this entire list. Every pound you lose reclaims something. Men I've worked with who lost significant weight describe it as a dramatic visible recovery, not because anything grew, but because it was uncovered. The solution is already inside your body. It's just waiting to be revealed. Now, I need to ask you something directly. When did you last have your testosterone checked? Because if the answer is never or a few years ago, cause number 3 may be the most important thing you hear today. Cause number 3, testosterone decline. Slow, quiet, and more destructive than most men realize. After 30, testosterone drops roughly 1 to 2% every year. By your 60s, many men are running on a fraction of what they had. And here's what that does to your tissue. Testosterone drives nitric oxide production. Nitric oxide is what signals your blood vessels to open up during arousal. Less testosterone means weaker signals, weaker erections, less fullness, less frequency. And here's the part most men miss. Regular full erections are actually a form of exercise for your penile tissue. They stretch the smooth muscle. They deliver oxygen. They keep the tissue healthy and elastic. When erections become rare, the tissue atrophies. It literally shortens. The emotional side of this is real too. The decline is so gradual that men adjust. They stop expecting morning erections. They stop initiating. They normalize the fade without realizing the fade is a warning sign. A simple blood test can identify this. And when testosterone is properly restored, men consistently report improvements in energy, libido, erection quality, and yes, visible fullness. This is medicine doing exactly what medicine is for. Cause number 4, This one has a name most men can't pronounce, and that's exactly why it goes undiagnosed for years. Peyronie's disease. It affects somewhere between 6 and 13% of men, and most of them have no idea they have it. Here's what happens. Minor repeated trauma to the penis, the kind that can occur during vigorous or slightly awkward sexual activity, causes fibrous scar tissue to form inside the penile tissue, called plaques. And unlike healthy tissue, scar tissue doesn't stretch. The result? Curvature, shortening, sometimes a noticeable bend or area of hardness that wasn't there before, a measurable reduction in erect length. And because of shame, most men carry this silently for months, sometimes years, getting more anxious, more avoidant, more withdrawn when effective treatment options exist. If you've noticed a curve that appeared out of nowhere, or hardness along the shaft, or erections that have changed shape, please see a urologist. Not next year. Soon. The earlier you catch this, the more options you have. Silence is not protecting you here. It's costing you. Cause number 5, your medication. And this one almost never gets mentioned in a doctor's office. Many common, everyday medications have a direct impact on sexual function and penile tissue health. 3 categories in particular. SSRIs, antidepressants, can suppress libido, dull arousal, and directly impact erectile response over time. Certain older blood pressure medications, particularly beta blockers, impair blood flow and erectile function. And finasteride, widely used for hair loss and prostate enlargement, can in a subset of men cause lasting hormonal changes affecting both function and tissue health. I am not telling you to stop your medications. I am telling you, if you're on any of these and you've noticed changes, bring it up with your doctor. Ask specifically, because alternatives exist. Adjustments can be made, but only if you start the conversation. Far too many men suffer in silence, never knowing their prescription was part of the problem. Okay, now let's talk about how to fight back. 5 proven strategies. Let's move through them. Trick number 1, use it or lose it. And I mean that literally. Regular erections are not just about pleasure. They're a physiological exercise for your penile tissue. Each erection stretches the smooth muscle of the corpora cavernosa, delivers oxygenated blood, and prevents the fibrous degeneration that leads to shrinkage. Research on men who underwent prostate surgery and temporarily lost regular erections shows clearly men who engaged in penile rehabilitation preserved significantly more length and tissue health than men who had no erections during recovery. Your body protects what it uses. It abandons what it doesn't. Practically, aim for regular arousal and erection several times per week. If erection quality is already struggling, talk to your doctor about short-term support options. We can work with this, but the tissue needs to stay active. Trick number 2, reclaim what the fad is hiding. The roadmap here is straightforward. Caloric deficit plus cardiovascular exercise plus resistance training. That combination accelerates fat loss from the pubic area and simultaneously supports testosterone production. But here's something I don't see talked about enough: pelvic floor training. Kegel exercises strengthen the muscles at the base of the pelvis. And when those muscles strengthen, visible length improves because the penile base lifts and projects more naturally. On top of that, erection firmness improves. Urinary control improves. How to do a Kegel: contract the muscle you'd use to stop urination mid-flow. Hold 5 seconds. Release. 10 reps, 3 times a day. Do that consistently for 8 weeks and you will notice a difference. Simple, free, effective. Trick number 3, rebuild your testosterone, starting tonight. Sleep first. Testosterone production peaks during deep sleep. Men sleeping fewer than 6 hours per night show measurably lower testosterone levels. 7 to 9 hours is not optional, it is treatment. Beyond sleep, compound resistance training, squats, deadlifts, rows, directly stimulates testosterone release. Managing chronic stress reduces cortisol, which actively suppresses testosterone. And diet matters more than most men realize. Eggs, fatty fish, pumpkin seeds, olive oil, these aren't just healthy foods. They provide the raw materials your body uses to produce testosterone. If lifestyle optimization isn't enough, and for many men over 60, it won't be, properly managed testosterone replacement therapy can restore what time has taken. Energy, libido, erection quality, tissue health, all of it. Don't let stigma stop you from having that conversation. Trick number 4, traction therapy. This is the most underrated tool in men's health, and it has real clinical evidence behind it. Penile traction devices apply a gentle, consistent stretching force to the penile tissue over time, typically 3 to 6 hours per day across several months. And the research is clear. In clinical studies of men with Peyronie's disease, consistent traction therapy over 6 months produced average length gains of 1 to 2 centimeters and significant reductions in curvature. Biologically, this works through mechanotransduction, physical force stimulating cellular growth and tissue remodeling. The same principle used in bone lengthening procedures. The key word is consistency. Gentle, sustained tension over time. Not aggressive, not rushed. If you're interested, discuss it with a urologist who can guide you toward a medically approved device and a safe protocol. This is not a gimmick. This is physiology. Trick number 5, protect your blood vessels. Starting today, we talked about how cardiovascular health and penile health are mirrors of each other. Here's the most important fact in this entire video. Erectile dysfunction typically precedes a cardiac event by 3 to 5 years. Your sexual health is your body's early warning system. So the most powerful thing you can do for your size and your life is invest in your vascular health right now. Manage your blood pressure. Control your blood sugar. Stop smoking. It is the single most destructive habit for penile blood flow. Full stop. And consider adding nitric oxide precursors to your diet. Beets, dark leafy greens, watermelon, pomegranate. These have genuine clinical evidence supporting improved blood flow. Not supplements. Real food. This isn't complicated. These are the fundamentals. And the fundamentals, done consistently, are more powerful than any shortcut. Gentlemen, let me close with this. If you came into this video feeling worried, maybe even a little ashamed, I want you to walk away feeling something completely different. Informed, clear, in control. Every cause we covered today has a solution. Poor blood flow, weight, hormones, scarring, medication. Every single one of them has a pathway forward. I've watched men in their 70s, men who had written off their intimate lives entirely, rediscover confidence and connection after getting the right information and acting on it. Age is not the ceiling. Silence is. So break the silence. Talk to your doctor. Take one step today. If this video helped you, give it a like so more men can find it. Subscribe to Dr. Revita for honest men's health content every week. And leave me a comment. Where are you watching from? And which of these 5 steps are you going to start with? I read every single one. I'm Dr. Narita. Your vitality is worth protecting. Your confidence is worth rebuilding. And your best years, they can absolutely still be ahead of you. Take care of yourself. You deserve it.